and get things rolling today. First of all, for those of you all on the call, I hope that you are following us on social media, Facebook, Twitter, and Instagram at GSO Chamber. That's at GSO Chamber for all the latest information. Those of you all on the call know that we've been sending out daily emails to our members with the recording of the call and any relevant links, so that we'll be able to get those to you immediately. Well, not immediately, but sometime this afternoon after the call, we'll get those to you. If you're not a member and you're on the call, we certainly welcome you. All of our resources, if you're not getting that, you're not a member, so you're not able to get that call or get that email, you will be able to find all of the recordings and all of those links to the resources at greensboro.org/COVID-19. And as we've started each one of these calls with, if you're at home, as many of us are, and you've gotten a census request in the mail, please take the time to fill out that census report. It means an awful lot to us in terms of the representation that we're going to get in Washington, D.C., as well as resources that might come from the federal government. As we can all now attest, it's very important for us to have those resources coming from the federal government. So please do fill that out. It's very important to our community. We're going to talk today on two different topics. One on the community's health, community health update, and then we'll get into a little bit about a small business continuity fund through the Piedmont Business Capital Organization with Wilson Lester, who's that executive director. But first, I want to go ahead and get into our community health update. Preston Hammock is with us from Cone Health. Preston is, hold on just one second. Preston serves as the president of the Moses H. Cone Memorial Hospital and senior vice president of Cone Health. He has been in that role as senior vice president of Cone Health with the hospital's day-to-day operations since last year, since 2019. Prior to that, Hammock joined Alamance Regional in 2006 and served in various senior leadership roles, becoming that hospital president in 2013. Hammock holds a master's degree in healthcare administration from the University of North Carolina at Chapel Hill, where he was a Benjamin Roden Scholar. And last, and certainly not least, actually his most incredible accomplishment, he has a bachelor's degree in biology from Duke University. Preston, welcome to the call. We're glad that you're able to join us today. Thanks for calling in.
Thanks, Brent, and appreciate the acknowledgement. Make it clear, everyone, where my allegiances lie with those 2 degrees. So thank you for making that clear.
I was going to say it's somewhat ambiguous with having both of those on your resume. So I appreciate you clearing that up for everybody there. So let us just start off with kind of give us an update, Preston, on where things stand from Cone Health's point of view, from your point of view. How is the community's overall health in this time of trials and tribulations of which we've not seen before?
Yeah, I appreciate the opportunity to share this. This truly is an unprecedented situation for our entire community. And it's one of those things that is fluid, is ever changing, and there's a lot of components with it. So I guarantee that I'm going to miss something that's important to you. And I would encourage everyone on, if you have a question, to make sure you bring it up so that I can try to answer it. As far as current state,
and that's Preston. While you're saying that, while you're on, the chat is there for everyone right now. So if you have a question while Preston's talking, make sure that you put it into the chat. Excuse me, down at the bottom of the screen. I'm sorry, Preston. Keep going.
Yeah, no worries. So, kind of the bottom line is really the coronavirus is real. It is here. It is a significant virus that has significant impact. We have been readying for this for a number of weeks, beginning a few weeks ago, canceling elective cases, reducing outpatient areas, making changes to the schedule because we knew that an influx of patients was going to come with significant medical issues. And as a result, over the past couple of weeks, we've had tremendous capacity at our hospital campuses. Much like many of you, normal business operations is completely different. Our normal patient volume overall is about half of what it normally is. And that's by intention because we expect this to grow, and we are beginning to see that right now. So volume is beginning to build. It's built even over the weekend. It's beginning to speed up in how that caseload is being built, and the patients are beginning to be generally sicker when they get under our care at this moment. So right now, as of yesterday afternoon, we update these numbers every afternoon. We did have 19 patients in our facility that are positive. That number has gone up. We are also modeling what this could look like in our community. Now, I think it's important to highlight a couple things there. One is modeling, which is squishy by definition. This is something we've not experienced before, and being able to project a pandemic is something that is always going to have elements to it that we try best to account for. It's not perfect. The other piece is that it's related to our community. So every community has different dynamics, and we are basing our modeling internally based on epidemiological reports, as well as what's going on here in our community related to demographics, related to the measures of social distancing that are being adhered to and taken into account. And we have a variety of scenarios now that we're planning for. I also really stress it's our community because at the national level, there's been some good news today. You may have seen some reports from Washington and New York that some people are kind of representing as glimmers of hope, and I hope that's the case. And it's different communities. And so what we're looking at is what we can expect here in Guilford County, in the Triad region. What we believe is that we are still 3 to 4 weeks away from our true peak. And that's how we're planning and preparing over the next several weeks. Now, that means we are continuing to cancel those outpatient visits that can be delayed, elective surgical procedures. In fact, we made a decision today to extend that time frame into May because we do think this is going to continue to be an extended event. Our visitor restrictions are in place. We have begun monitoring staff for symptoms, as well as today, this afternoon, we are now masking all staff as they walk around the hallways of the hospital. And that's, again, just to prevent community spread. Often you may have, there's been cases where there are people that are asymptomatic that have been able to spread this virus, and we want to be cognizant of that. We are also doing several scenario plans, in particular, looking at the resources we have. I've gotten lots of questions about what about the recently vacated women's hospital. We're reviewing potential uses of that. One part of that is how quickly could we get it open if need be. So that's part of the element. One thing I've been telling my teams lately is that in situations like this, often closing a door is just as valuable as opening one. So in many of our analysis, if something looks like it's not going to work, we try to call that out. Right now, that is something we're still exploring. We have not eliminated it yet, and we're continuing to watch and see what sort of resources we may be able to mobilize quickly. I will say I've gotten lots of questions about what can I do. First of all, I want to thank so many of you who have helped us. We've gotten donations. Several local universities, colleges, community colleges donated tons of supplies from your healthcare programs that aren't in session. We've had the maker community working hard to produce some 3D printed supplies like face shields. Many organizations have come to us with either products that we've been able to put into service or that we're actively evaluating, and I just want to say thank you for that. Please continue to bring stuff like that forward. The biggest thing you can do is to continue to urge your staff and your teams to follow the stay-at-home orders. When we look at modeling, I mentioned we use local epidemiological data as well as local patterns of social distancing. The minimum and the maximum, when we look at models, the maximum really does have us at a point where we are beyond our capacity in terms of both beds and supplies. The minimum has us within our current capacity without even having to expand to other areas. And that's a really big difference. And I mentioned that that's squishy because, again, it's an unprecedented scenario. However, I do think it's important to remind people of that. And also to remind people that it takes 2 to 3 weeks to see the impact of some of those social distancing. So even though many of that's been in place now for a little bit, we're not going to really be able to see the impact on that on our projections until that's in place for another week or two. But that's kind of the nuts and bolts of what's going on. We do have a webpage, conehealth.com/coronavirus, that can bring you up to speed on many things that I've talked about, encouraging when to use the hospital or the emergency department. We are encouraging people to reach out to their primary care physician if they feel like they have symptoms, and only come to the emergency department if you're really sick. There's an e-visit platform that we use that's either video visits or electronic visits that I would encourage everyone to utilize. You still get excellent medical care. It can help people make sense of some of their symptoms and make a professional determination of if you need to seek care or not. But that's kind of where we are at the moment. I'm happy to talk about anything that is relevant because I know that I've skipped over some parts.
That's great. That's great. Preston, let me ask you just a technical question. So if I want to get an e-visit, I just go to your website and sign up for an e-visit? Is that as easy as it is?
It is. There's links there on the website that prompts. There's even a sort of initial symptom checker. But the e-visits, we've made them free to the public right now in particular because, again, we want to encourage their use, and that enables people to stay at home and stay away from others if they feel like they're having symptoms. But yes, it's all on that website, and there's information about how to schedule an e-visit and how to complete one.
We have one question on our chat, Preston, that talks about volunteering. Is it possible to volunteer in today's environment? What are your thoughts and tips on that?
So at this point, the answer is no, and that's really for two reasons. One, we're trying to limit the number of people on campus at any point in time. And also, we're really leveraging areas of our organization that have shut down, whether that be an outpatient rehab facility or things of that nature, that we're taking our own staff and putting them right back into service. I say right now because that always could change. And if there comes a point that we need some community volunteers in person, we'll certainly put out that call. But right now we're saying no. We're trying to keep people away from the hospital campuses unless they really need to seek care themselves.
Another quick question in terms of the number of cases. Is 19 cases for all of Cone Health or just at the main hospital at this point?
So the 19 was the number for all of Cone Health yesterday afternoon. I would point out that test results come back in bunches, and we have many more than that are awaiting results. I've also gotten questions about testing. Do we have quantity? Right now, we do have the quantity that we need. That's gotten a lot better in the past week. Last week at this time, it was frequently taken 5 to 7 days to get a result. Now we are getting results within 24 to 48 hours. There's been many articles on the news nationally about even quicker turnaround testing. We are pursuing those options. We hope to have even quicker turnaround in the coming weeks. That affects our models and how we act there. But we do have access to tests, and we are getting much better turnaround. I do expect that number to go up after the update this afternoon.
I would only imagine. Quick question on more space. So you're evaluating Women's Hospital. There's a question as to, are there other locations that you're looking into for more space?
Yeah, so locations and how we use what we have right now. The end of last week, actually, here at the Moses Cone main campus, again, because we've eliminated many of our elective surgeries. One of our nursing units, 5 North, is commonly where orthopedic surgeries are. Many of those are elective. It's much less than that. We've merged those departments with 6 North that creates an open nursing area. That's true for all of our hospitals throughout the system right now. So when we look at it, the former Women's Hospital, it's off of Green Valley Road there. That's kind of the one facility. But within each of our hospital facilities, we're looking at how could we expand into different areas of our buildings, either to spaces that are not maximized in use, or even some other creative spaces that are more communal that we can put up temporary dividers and separation. A lot of that's learned from our colleagues and experiences in other states that are further ahead of us on this. Mm-hmm. And that's been very useful to continue those conversations. So it's a lot right now. And hopefully we don't have to push those buttons, but we'll be ready if we do.
This question may test your expertise, but I know there are a lot of folks out there, with the CDC and others saying, hey, when you go out, especially to areas where you might encounter others, let's wear something over our face. What's your perspective on the effectiveness of homemade masks versus N95 masks and going to a grocery store and that sort of thing? Do you have any tips for folks on the call for that?
I sure do it, and I'll tell you, I've learned more about this than I ever dreamed over the past several weeks. Bottom line is this. What we're saying is that, yes, we agree with all the guidelines you're seeing out there, that at the point now, wearing a mask, whether that's homemade or a mask you already have, would be beneficial going out to public. What that does is it prevents you from kind of, spewing your own droplets, I guess, so to speak. I was trying to say that better, but I couldn't really figure that out on the fly. But it benefits, it really kind of helps prevent you from being a danger, so to speak, to others. However, not an N95. An N95 respirator is a very high degree of protection that really needs to be reserved for active treatment of patients who have been diagnosed who are also undergoing aerosolizing procedures. The reason why I say that is because N95s are in short supply now worldwide. And much of our effort is making sure we have those on hand for the healthcare workers going into inpatient rooms treating patients that have this condition. So using something like that going to the grocery store would be overkill, but having some type of mask, even if it's homemade, would be beneficial at this point. In fact, the universal masking policy that we put in place today here all across Cone Health is giving masks, not N95 respirators, just regular basic masks to all employees with the request that they wear them around throughout the facility to help protect our own staff.
So a bandana is a good opportunity for folks?
It's not bad. If you don't have anything else, it's not a bad thing, because really what that mask or bandana does, it's a little extra layer of protection around social distancing. I would offer the caveat that if you're wearing a bandana or a mask, it doesn't mean that you should now get within 6 feet of other people. It's an added benefit for additional protection.
Very good. Very good. We've got somebody, and there are a lot of folks in our community who have been wonderful about providing ideas and products and that sort of thing. And I see Zach Lyon on this. It says, I've got a product to help people self-serve their conditions in the home environment. Zach, if you've got something like that, we'd love to talk to you at the chamber. David Ramsey would be somebody. So if you want to private message David on the chat, David can give you some more information on that. Another question on training, testing protocol. Who gets tested, and when they're waiting to get back to test, are they staying in the hospital?
Yeah, so that's a good question. It depends on what's going on clinically. There have been many patients who have come to the emergency department. I do not recommend this unless you really have significant symptoms, just because we're trying to make sure we can take care of the sickest. However, if they're not sick enough to be admitted, they could be tested and sent home with instructions on how to quarantine themselves at home until the test result comes back. And then if the test result is positive, they're given instructions about how to continue that quarantine, as well as how to reach out if their condition worsens. If the test is negative, they're given those results and say you no longer need to quarantine yourself. So there have been many patients who have been discharged that way and await results at home.
Gotcha. So it just depends on their status, their condition at the time. Mm-hmm. Gotcha. Another question here about a lot of people have lost their jobs, which provided medical coverage. Are you aware of federal or state funds to help with medical coverage if COVID-19 treatment is needed? What's the status there?
That's a really good question. I'm not aware of specifics, although I do know that, I know there's been a lot of legislation and things around waiving costs of the tests and some of that care. I would just offer that we have, charity care policies that we have employed. We don't turn anybody away. In terms of if there are specific elements in the different aid packages that have been passed, I don't know, but that's something we can look into and find out.
Great. One more question here. Folks have extra items like masks or even gloves. Can we donate these items to local hospitals? And what if the box has been opened? So I'll go ahead and admit here, I had 2 N95 masks that I used to go under my house over the summer, and so those have already been corrupted. So I don't think you want those. They're full of dirt at this point. But what if somebody's got a mask or gloves? What kind of condition, and are you looking for those sort of things by donation at this point?
So I would say yes. If you have boxes that are unopened, if you have industrial N95s in particular, we've gotten quite a few donations of those, and we can figure out the best way to do that. Brent, if you want to connect people to me, I've got a specific person on our team that takes a look at those donations. We do have an internal team that makes sure that they're going to meet our needs and offer the protection that we have. And then assuming that the answer is yes to that, they can coordinate how to get those items. And if it doesn't meet our needs for some reason, they're also able to explain, here's why that doesn't work. But yes, if you have those things and they're unopened, in particular, surgical masks, N95s, face shields, even some shoe covers or hair covers are things that we would gladly accept if they're unopened.
Okay, great,
Preston.
great. And so,
This is Lisa Pennington, and I would say an easy, quick thing to do is you can go to Cone Health, and there's actually a link for donations. And so we have one team that's so it's right on the website.
Just a minute, Nikki. I'm trying to figure out how to turn this call off. Okay, I think
there we go. Sorry about that, y'all.
Yeah, I think what Lisa was trying to say is there is a section on our website that if you have a donation, you can coordinate there as well.
Great. That's perfect. Lisa, can you send us that link?
Yes, I can do that.
And we'll get that out.
I will.
That'll
And
help.
I'll give you
Wonderful.
another, just another plug too. We have two teams. Preston alluded to that. We have one entire team working on just the donation of medical supplies, but we also have another team that's accepting, coordinating through the downtown Greensboro group that's doing food deliveries for our staff and things like that. So lots of opportunities, and we'll be happy to go through the process and get back and let you know whether we can take what you're offering and arrange for the pickup of that. So yeah, I'll send you.
Lisa, you may want to take this one. Do valved versus unvalved? I'm assuming that means N95 masks matter.
Yeah, so that's part of the vetting process. If you have an N95 mask that's labeled as such and is unopened, let us know, and our team is able to determine if those offer the level of protections that are needed. They look different in many cases, and some of them have valves like you're talking about. Some of them do not, but that's part of how our team evaluates if we can use them.
Excellent, excellent. All right, one last question here. Is there coordination among different hospitals in our area, meaning Cone, Novant? How are you all talking to each other at this point? And what does that mean for us?
Yes, we are talking with one another. Terry Aiken's spending a significant amount of his time making sure that we're discussing those things, because as I mentioned, there's a variety of potential scenarios, and if we get in the worst scenario and we have to open, in some cases like in New York, you've even seen field hospitals, things like that. If it looked like projections were aligning for something like that, that's something we would approach together and really focus on serving this community as a collective if possible.
Excellent, excellent. Well, Preston, I want to thank you very much for being able to join us today. We really appreciate it. Great topic, great update. Thanks for answering questions. Obviously, there are a lot of them out there, and it continues to evolve in terms of our knowledge of what's going on. So we appreciate you being willing to join us, and please stay in touch. If there's anything that we need to do, anything that we need to, information that we can get out to our members, don't hesitate to give us a ring and let us make sure that we're getting it in the hands of the folks who need that information. But I can't thank you enough, and please pass along our thanks to everyone in your operation. We know from top to bottom the stress and strain that you all are going through right now on our behalf. I love these pictures that keep saying we're here for you, so please stay at home for us. And I can tell you, looking out my front window here at my house, I do feel a little caged sometimes, but I really do appreciate you all being there for us, and I will stay home for you. I promise that.
Well, I appreciate that. I would encourage everyone, if you know someone that works in healthcare, works in Cone Health, reach out, a little note, a little thank you. It goes a long way right now. This is going to be an extended event. It's not going to be over tomorrow, and it really requires some tremendous work from some tremendous people. So every word of support like that goes a long way, and I'm so appreciative for the community and the support we have here.
Well, please pass that along to everyone, and again, thanks for joining us. We'll let you go back to work while I go down the line here and try to find Wilson so that I can unmute him, and we can get him on here in just 1 second. But again, thank you, Preston. We appreciate you.
Yes, sir. Thanks so much.
And there's Wilson. You are unmuted, Wilson. How are you doing today?
I'm great. How about you, Brent?
I'm doing great. Let me give a formal introduction as we transition from the healthcare section of our day today into the business capital portion of our day. Wilson Lester is the executive director of Piedmont Business Capital, a CDFI. He works diligently to create relationships with businesses in urban and rural community through micro lending in support of the operational expansion and new business development for women and minority entrepreneurs. Wilson is in charge of and working on a small business continuity fund, which is in great demand right now as we go through this unique time in our history. And Wilson, I just wanted to give you an opportunity. First of all, I wanted to say thank you for joining us and thank you for everything that you do for our community. But wanted to give you kind of an open, 3 to 4 to 5 minutes to talk about what's been going on in your world, what you're seeing, and kind of where you're starting to hopefully plug some of the holes that might be out there for some of our small businesses.
Right, Brent, I appreciate the opportunity and I appreciate the Chamber for hosting this call, and certainly appreciate Preston for being on and sharing that information, which I found useful and I think we all have. So just like everyone else, all industries have been impacted by the advent of COVID-19, and particularly on our economy and, in my world, the small business economy. There are so many organizations dislocated by the necessary ordinances that have been put in place to protect the health of our community, but also have a side effect. So we were particularly concerned about our businesses that were in the way of personal care, barbershops, salons, a number of different businesses like that. We have a huge industry of massage businesses in Greensboro, yoga studios, anywhere where people have to sit and stay in order to conduct commerce. That's their business model. We also have restaurants throughout our community that are locally owned that are affected in a number of different ways. Some did not have heavy takeout or delivery concepts as part of their model to drive revenue and are having to pivot in some cases to make up the restaurant revenue that would come from folks being in store. So what we found is, none of the businesses in that segment are interested in their profits right now. They're really just trying to figure out how to survive other end of the quarantine period. So we took a look at what some of our industry peers were doing, and our board set out by approving $150,000 for a small business continuity fund, which the city of Greensboro has now come alongside of and approved a resolution for an additional $400,000 to be added to what we intend on doing and are actively doing in the community. We released the application for the Small Business Continuity Fund on last Monday, March 31st. We've had over 125 applications started, over 30 businesses have completed the application, and we've already approved somewhere between $45,000 and $50,000 in loans as of this morning, and expect that the total number that we have available to be encumbered in the coming weeks, and are working with other community stakeholders to take a look at how we can create a capital campaign to add money to this loan pool. This loan pool is specifically for folks that are in the city of Greensboro. The application is very simple. We just need a copy of your articles of incorporation, or if you're a sole proprietorship, your executive summary, at least 2 months of personal and business bank statements, a copy of your lease or mortgage documentation for where you operate your business out of, a list of your monthly expenses with verified documentation, and your year-to-date payroll summary. If you do not have your year-to-date payroll summary, if you're a sole proprietorship, if you can demonstrate your distributions to yourself via your bank statement, we can work with you on that. Right now, we're working very hard to be able to approve these loans in a 72-hour period, given we have receipt of all documentation, and that's approve and fund. It's extremely critical right now here at the beginning of the month. The businesses that have had their income stymied over the course of March have access to that capital to keep current with their landlords and their monthly payments, as well as also help support keeping their employees in place. We are following the guidance of a number of things that SBA is doing as they take a look at how they fund some of the programs that are out in the marketplace right now. And we're just very happy that we have such strong partners in the city of Greensboro and others to help us coordinate this effort right now.
Wilson, talk to us about where people can find this application. Is it an easy website link? How do we get that application out to folks who are interested on this call?
Great, thank you. So as soon as you go to our website, PiedmontBusinessCapital.org, the COVID-19 tab is the first thing that's there. You can go through that. It shows you the list of documentation that you're going to need ready to be able to provide. And you go through about a 14-question application. And the last 5 questions on that application are all questions that will require you to upload documentation. And we even put a quick link in the application to a YouTube video. If you're unfamiliar with creating a PDF form or for that matter, you can watch that video. It's about 4 minutes to show you how to create the document. And each one of those questions, you just upload your documentation to it. Once you submit your application, in less than 24 hours, you'll get a contact from an entrepreneur coach with our organization that will let you know whether or not we have all the correct documentation, and if we need some additional documents, they will work with you to get those input into your application, and then it is forwarded on to be approved or declined. The way that we're working that is we're looking at about 4 weeks of operating expenses and then doing a multiple of 1.5 so that we can provide 6 weeks of operating expenses that include payroll so that you can maintain the continuity of your business during this downtime and get past what we know as the defined quarantine period for the state of North Carolina to be April 29th.
Wilson, is there a maximum for that when you put those
right. So
6 weeks in?
Right. So the cap on the loan is $10,000, and the payments are deferred for 90 days. And again, this is a 0 interest loan.
And what's the 0 interest loan? What's the term? What's the length of a payback typically with the fund?
The terms are going to be 48 to 60 months.
Okay. Couple of good questions here. Does the program cover not-for-profit businesses as well, or is this just for profits?
Yes, it covers non-for-profit businesses also.
Very good.
And I can give you a quick list of the businesses which are in the FAQs, but it includes nonprofits, veterans organizations, sole proprietorships, self-employed individuals, and independent contractors. So all businesses fall under this group.
Very interesting question on chat here. You're probably seeing it as well. Can this be used to start a business for people who have been laid off? Absolutely not. Okay.
This is
businesses that have been established. So you've got to be looking backwards at some past performance.
Right. The only way that we can verify true costs is through past performance. We wish that we could help in that way, but there are some other resources that we can help you identify in the community that are available to provide finance for folks that have experienced some displacement due to loss of employment to be able to start a business, and we'd be happy to walk you through that. But this particular program is for businesses that are indeed in operation and have been, because we're looking back to your activity prior to February 15th.
Good question here. So are there any restrictions on how your funds can be used? So when you do get approved and the funds are distributed, are you watching? Is there a report due back? What are the restrictions on how those funds might be used?
Yes. So the funds have to be used for salary or wages. They have to be used for rent or mortgage payment of your facility. They have to be used for identifiable utilities and other expenses associated with the cost of operating your business. So that's the information that we're asking on the front end to verify and then define the amount of your loan. And those will be the exact activities that those dollars should be attributed to. And we will do a 45-day check-in.
Gotcha. Really good question here in terms of stackability. So can we apply for this loan and still apply and be approved for the paycheck protection plan or the EIDL loans? Are you anticipating being kind of a bridge between this time and the time that they might get to a PPP or an EIDL award?
Yes, so that is a great question, and I appreciate that. You absolutely can stack this with the PPP or EIDL opportunities, and we would take a subordinate position to SBA.
And I know you have a number of other businesses that are already have already taken on some debt from Piedmont Business Capital. Are you allowing them to take on additional loans with this particular program as well?
It's on a case-by-case basis right now, Brent. What we
Gotcha.
have done is we deferred all the loans in our portfolio for 90 days to give some breathing room. And we are beginning to talk to some businesses that are in our portfolio that may have been paying on a term note for a while and now have some room in between the principal amount and what their original loan amount was to convert that difference into something like a line of credit. If it makes more sense to provide the small business continuity fund during this time than to do that for those individual businesses, we will go that route. But yeah, we are working and keeping a close bead on everyone that's in our portfolio to make sure that they have the support and the information about the different resources that are available in the community right now so that they can make the best decision possible.
And that's exactly why I asked that question, Wilson, is because you're acting exactly the way we want all of our lenders to act, right? We want to work with you. We want to keep you up and running in this process. And if that means deferring something, changing something, working with you to make sure that you're going to continue to remain on your own two legs through this process, and we get to the end and we can talk about how to make up for it later down the road, right?
Yes. So when you go to that page, when you hit our main page, you'll see a little button underneath a couple of paragraphs that talks about the Small Business Continuity Fund that says "Start My Application." That is the application. When you click that button, you'll be taken through a series of questions, and then eventually get to the questions where you will need to upload documentation. So that list of items that you'll need, your articles of incorporation or executive summary, your bank statements, those things you'll need to have handy, because once you click that button, you'll be taken into the application to begin to answer questions and upload documentation to be submitted to us.
So Wilson, you said at the beginning that you've got 125 applications started, 30 have been completed. Are they starting to bog down when they need to provide you documentation? Is that what you think is kind of the hurdle for folks at this point?
I most certainly think that that's the hurdle for folks at this point. And also, I think it's the question of what resource do I take? There are a number of resources being made available due to the stimulus that are both helpful and definitely spot on. The difference is timing and the estimation of timing. The SBA product, I think, is absolutely necessary, and if you can apply for it, I would apply for it. But the critical thing is people have expenses today, and they need capital as quickly as possible. So while to some businesses a $10,000 loan may not be significant on any given Sunday, but when the game is this tight, it's you need what you can get your hands on, and we're trying to provide some capital that people can get their hands on.
And you're looking at about 72 hours for a turnaround. When that loan is approved, how quickly can the funds be dispersed?
So right now is we disperse capital today for loans that were approved on Friday, and that's just because of the weekend. But if we get a new application in today that is complete and has everything that we need, it would be the underwriting would be finished by midday tomorrow. We would create the paperwork for the borrower tomorrow, and if the borrower got the paperwork back to us yesterday, we could submit it for or tomorrow we could submit it for disbursement. If they don't get it back to us Wednesday, we would submit it for disbursement on Wednesday, and they would have the funds on Thursday.
That's great. That's great. That's exactly what is needed right now. Wilson, I appreciate you taking on this. I know that means for some really long days and some complicated days and some crazy days, but just the way we thanked our friends at the hospital and in the medical profession, we thank you as well, because you're on the front lines of keeping those businesses alive through this process. So we've got to worry about people's physical health, and when we got to worry about business health, and you are on the front lines for business health. So Wilson, I can't thank you enough for that. We've got one last question here that says, can you distribute the funds via direct deposit or check? I'm assuming, and maybe I shouldn't assume that direct deposit is a possibility, but is it check or direct deposit at this point?
Right. So everything about this process is electronic. The application submission is electronic. The closing is electronic, and the funds are dispersed through ACH.
Perfect. Touchless, I think, is what contactless is is a new term that I think has sprung up through this. You can get your groceries delivered contactless. You can get your food delivered, your takeout delivered, or your contactless, and now you can get your money contactless too, right?
Right. So and that's how we normally do it. We normally disperse funds through ACH, but we want to make sure that we keep in guidance with what all the governing authorities are communicating to us, and we want to keep staff and the businesses we serve as healthy as possible. So we are moving to a contactless era.
Gotcha. Got a question here. One last one. Maybe we can. If the PPP covers an 8-week period from loan origination, can these funds be used for payroll before getting this loan or following the 8-week time period? I think that's exactly what these funds are meant for, right? Let's get you through that time period, get you to those PPP funds, and we go from there, right?
Right. Right now we're trying to get those folks that are in that long line for the PPP program suited with some capital that can help them in some way during this time. There's a $10,000 cap on it, but we want to make sure that people have continuity of operation support for at minimum 6 weeks.
Excellent. Well, Wilson, thank you again for your time. Thank you for your dedication to this cause. We really appreciate it. We'll have all of those links, folks, up on our website, as well as be sending them out to our members via email. Wilson, again, appreciate your time for that. Tomorrow, we'll be talking insurance. So In the midst of this, there are a number of questions that have popped up from our members and other businesses about insurance. And so we'll have Stan Park with Assured Partners Insurance joining us tomorrow to talk about all of the new and maybe some old questions that have popped up with insurance, from business interruption to health insurance to everything in between, everything that we are experiencing that perhaps some of us never thought we would, but so hopefully some of our insurance agents had been thinking ahead for this eventuality, and he'll be talking about the kinds of questions that you should be asking your insurance agent right now as we go through this. So we'll be back on tomorrow at 3:00 again with Stan Park of Assured Partners. Again, let me thank you, Wilson. Let me thank Preston for joining us from Cone Health. And until then, everybody stay home, stay healthy, stay safe, and we'll talk to everybody again tomorrow at 3:00. Thanks again for joining us.
Hey, Brent, real quick. I'm sorry.
Yes, sir.
I know people are falling off.
Sure.
I saw one last question.
Yep.
On the application, under bank statements, and I think one other area, we're asking folks to consolidate their bank statements into one PDF. So if they got a bank statement for March and February, put it all in one PDF when you attach it.
And you
So
can
that
go
it's
to
just-
that YouTube. You can go to that
And you
YouTube
can
video
watch
and
that
learn
on
how
the
to do
YouTube
that,
video,
right?
so you
You
understand.
can learn. You can learn anything on YouTube, right? Anything.
YouTube
including how
University.
to- Exactly right.
I appreciate you
let's
so
hope
much, Brent.
let's hope that we got a lot of folks on this call getting ready to go to your website and make that happen. So everybody, until tomorrow, hang up and get cracking on those applications, and we'll talk to everybody again tomorrow at 3 p.m. Thanks again,
Awesome.
Wilson.
Thank
We'll
you.
talk to you soon.
I
Thank
appreciate
you.
it.
Bye now.